Trying to conceive can be a very challenging time for some couples. Like in a typical African setting, you're expected to be seen with a baby bump, say 3 to 6 months at the most after your marriage. And if it's not happening, you begin to face some kind of pressure, even from yourself and from your outside world. Every month happened to be a month of a shedding tears, sleepless night, and crying for you. As soon as your flow comes, you just begin to cry and complain. As soon as there's a little delay in your menstrual flow, you want to dip your pregnancy test into your urine, and when it comes out negative. If you're faced with every form of anxiety, at times depression, and also sleepless nights. These anxiety, depression, and all that can put you at risk of chronic stress. And when you are faced with chronic stress, your hormones are dysregulated. Dysregulation meaning kind of imbalance in your hormones. Now, one thing you face as a woman if you are having chronic stress, and especially if you are trying to conceive, is a decrease in your libido and an ovulation. One symptom of depression is losing complete interest in some things that you normally enjoy to do. So you lose interest, one of which is intimacy. If you have a decreased sex libido, decreased libido, you no longer want to get intimate with your partner. And you have to do the do to get pregnant. They're not a drinker for water, and they're not a chopper for food. So you must do the do. If you don't do the do, pregnancy cannot come. And that is why it is important you address that part of your life. Secondly is ovulation. If you are stressed mentally, emotionally, or even psychologically, the hormone cortisol is released. Hormone cortisol happens to be the primary stress hormone. When it is released, your hypothalamus and the pituitary gland are very sensitive to this hormone cortisol. So when it is released and your pituitary gland is affected, you may be faced with the chance of not ovulating. Why? The pituitary gland happens to be the chief gland that releases the hormone, the follicle stimulating hormone and the luteinizing hormone, which are the two major hormones that is responsible for ovulation. So because it is affected, pituitary gland is affected, these hormones are not released, and then you are not ovulating. Bearing in mind that ovulation is the major key to conception. So if you are not ovulating, you cannot fall pregnant. Now, if you think that you have done everything possible, you've done all the tests, and then you keep hearing them say you are fine, nothing is happening, wait for God's time. Of course, we know that there's God's time, but it is also important you ask them to run some tests for you to be sure that your cortisol level is not high, because when it's high, every other hormone is dysregulated and things will begin to go wrong in your body. So visit your doctor, let them run the test for you, be sure your cortisol level is not high. If it is high, they will also do 1 or 2 for you to bring it to the normal range for your other hormones to function the way they should. Keep well, you guys. Enjoy your day. Bye.